Welcome to part 2 of Charlie's edition, The Joy of Gay Sex series. In the first part, we explained a little bit of information about drug abuse and some of the drugs that are commonly used in the gay community. Now I'm going to continue to explain a little bit more drugs that are used. So in the first part, I told you guys about ecstasy and cocaine. Ooh, I just flipped y'all off, I'm sorry. And now we're going to talk about meth. I'm going to go smoke some meth. Commonly known as crystal or speed, this drug has become increasingly popular at dance clubs and circuit parties because, like ecstasy, it allows men to dance all night, producing a feeling of increased energy and a decreased need for sleep. Crystal, also called meth, can be snorted or injected. It heightens sincerity, awareness, self-esteem, confidence, verbosity, grandiosity, and something. Unlike oxybates such as morphine and heroin, which usually promote social withdrawal, crystal also elevates mood and sex drive while decreasing feelings of anxiety and inhibitions. Crystal users feel more attractive and find it easier to cruise for sex. Crystal users are also more apt to indulge in kinkier sex, such as S&M or fisting. All this good feeling is caused by the sudden release of dopamine, an important neurotransmitter in the brain. Like ecstasy, crystal intensifies social interactions. While sexual desire is heightened, sexual performance takes a nosedive. The user may not be able to get it up or come, hence the term crystal dick. Crystal users have a reputation, well supported in research, of getting effed more often than they do without the drugs, perhaps because of their temporary impotence. Research has also found that 2/3 of men on crystal were getting effed without condoms, and therefore crystal users have a higher HIV transmission rate. Other side effects are an inability to eat or sleep while the drug is in effect. Afterward, the depression often sets in with a marked need for sleep. More significant after effects associated with long-term use include stroke, liver damage, high blood pressure, and in a few cases, psychosis. Crystal should not be combined with protease inhibitors. Meth is highly addictive. In the state that I live in, certainly a really big community for doing that type of drug. So the next drug are poppers, and in some pornos you actually see the stars using these. It comes in those little bottles that has the liquid in it. No comment. It's kind of like, I don't know, you snort it and I'll read about it. Anyl butyrate is sold as a liquid and produces fumes that are inhaled. Familiar right in clubs. Poppers usually come in small vials. The drug is a vasodilator that produces its high by expanding your blood vessels so quickly that your blood pressure drops. You get dizzy and the room seems to spin. The liquid may burn the skin if it makes contact. It is highly flammable. In the early years of the AIDS epidemic, poppers were mistakenly blamed for the disease, revealing both the level of misinformation at the time as well as the prevalence of the drug in the gay community. Some deaths have also resulted from the combination of poppers and Viagra. Both drugs dilate blood vessels, and the combination can reduce blood pressure to a lethal level. Poppers should not be used by anyone with cardiovascular disease. Very interesting. Very interesting. I'm learning things right here myself. GHB, also known as a grievous bodily harm. It says, GHB is taken orally. Its peak is in effect 20 to 60 minutes. The high lasts for about 90 minutes. It induces a pleasure state of relaxation and tranquility. The user feels placid and has a tendency to verbalize, like ecstasy. GHB is a sensual but not sexual drug. There are special dangers to this drug. The dosage can be confusing. Basically, it passes you out. It's also known as date rape drugs. Let's see. Basically, you don't remember what happened. It makes you fall asleep. It's like taking a bunch of sleep aids. So, no comment. And I guess the next most used one is oxycodone. It's the generic name of a medically approved oxybate that doctors prescribe to control pain and cancer in orthopedic patients. The pills are crushed and snorted or injected for their heroin-like high. So pretty interesting. Very interesting. So basically those are the drugs that are used most often supposedly in the gay community. And once again, ecstasy, cocaine, meth, poppers, and GHB and oxycodone. Very interesting. So I just wanted to give you a little bit of information about those different drugs. Now, if you have not seen the information on the previous, on the other drugs that I talked about, go back to part 1 of Charlie's Edition, and you will see some information on those drugs, and some information about drug abuses, which I talked about on the very first part of the Charlie Show. And of course, it's best not to have sex while you're on drugs, because yeah, a lot of things like that do happen, and people get raped, and you wind up having unsafe sex, and a lot of different things when it comes to that. So, I'm going to go ahead and take a quick break, and I'm going to, we're going to move on to our very next topic. So, stay tuned to the Charlie's Edition. Kyla. Alright, so the very next subject that I'm going to talk about is something that is very important to talk about with straight folk and with gay folk, and that term is barebacking. I'm going to read to you guys exactly what barebacking is and dangers of barebacking. Barebacking is basically screwing without a condom. It is the single most dangerous sex practice there is. As a method of sexual gratification, it's as old as recorded history. Until the arrival of AIDS, gay men never used condoms when effing. In fact, pulling out before you came was considered rude. Until the mid-1980s, condoms were deemed kinky, a sex toy among gay men. The AIDS epidemic caused a change in the way of having sex. As of December 2000, 775,000 people in the United States have been diagnosed with AIDS. The figure for HIV disease is much higher. 500,000 have died. The worldwide statistics are even more alarming. Since we know so much about the transmission of the virus, screwing someone without a condom is equivalent to two men playing Russian roulette with each other. Younger men seem to be more attractive to barebacking. Perhaps these risk-taking men haven't watched the slow death of lovers and friends. For them, AIDS is history. Like learning about the Vietnam War, it's simply not in their experience, as it is for an older generation of gay men. That's too bad, because it's a statistical certainty that some of them are going to pay a price, the diagnosis of HIV disease. It would be a mistake, however, to look at barebacking only from a moral perspective. Recent research informs us that emotional problems influence a gay man's sexual behavior, including his contribution in transmitting the HIV. Depression is the main culprit. Gay men who are depressed, including both acute and chronic depression, are far more likely to participate in unsafe sex. Men with impulsive personalities, especially excitement seekers, are another category of psychologically impaired gay men. They generally describe themselves as spontaneous and claim that this is untrue. A man who is spontaneous can make voluntary choices about his behavior. An impulsive man cannot. Both depression and impulsiveness can be effectively treated by both medication and psychotherapy. If you have a friend who is endangering his life by barebacking, ask yourself whether psychological problems may be the cause. If so, taking a moral approach won't change his behavior, nor will accusing him of stupidity. Help him to make an appointment with a shrink, but not only one well versed in gay sex and HIV research. How does a responsible gay man like you fulfill his sexual desires but not endanger himself and other gay men? If you're going to screw, carry condoms. Have them in your night table in your bedroom. Insist that your partner use one if he's going to F you. Put the condom on or put your clothes on. Ignore the entreaties of a man who says, "You can F me without a condom," especially since you can be sure that he said the same thing to the man who screwed him last night, and the night before, and so on. If for some reason either you are under the influence of alcohol or recreational drugs or a mix of both, you do bareback, be sure to get tested a month later. If you test negative, get tested again in 2 or more months. If you believe the man who screwed you might be HIV positive, treatment with AZT is available. There may be a day when condoms are no longer necessary because AIDS scientists have successfully produced a vaccine. That's steer years off. In the meantime, lovers who are both HIV negative and never trick out need to worry about the HIV or STDs. Pretty scary. So basically, the bottom line is, you don't know somebody, or if you have sex with someone, use a condom. Now, if you're married and you know that your partner's not cheating, blah, 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 that may be a different story. But, yeah, definitely most of the time, use a condom or don't have sex at all. Very interesting for tonight. So, basically, yeah, so basically I wanted to just talk about the drug abuse and the different drugs that are out there, and also, the barebacking thing. So coming up on part 3 of Charlie's Edition, which will be the last part of the show tonight, we are going to talk about one more topic. So stay tuned and holla back. Be sure to comment and subscribe and rate. Holla back.